Hello, I'm Dr. Harley Farmer, and this is the seventh in my chapter series in my book, What is Eczema? How to End the Misery Quickly. This chapter is on misconceptions. Now, I stress straight away, this is the chapter that really rattles some cages. Some people get extremely upset with what I'm proposing in this chapter. So be aware of that. I prefer you to see it as a sense of sport. I like to put myself out there to be criticised, proven wrong. I've been doing that with eczema for a large number of years, and what we're now left with is the bits that people can't prove wrong, but they still can be provocative. And I'll start by saying that there's a misconception that moisturisers moisturise. The word is good, so I think I'll take you back 30 years or so from when people first introduced the moisturisers we know now. What was happening was somebody would have a dry piece of skin, and on the knowledge that there's always moisture coming up through the skin, if that's a dry patch and you want that to be moisturised, why don't we just cover it with a mineral oil, which is going to stop any moisture getting out, so all this moisture that's coming up will be trapped. The logic is very, very good, and therefore it's worked very well for marketing reasons. But a thought for you. If that was slightly dry, you put a moisturiser on for a week, and you've got 7 days of all this moisture coming up, by then this patch should be soaked. But have you noticed how you still need moisturiser? In actual fact, it's still dry. That's why I suggest to people, start thinking that moisturisers do not moisturise. Now we come on to another one. This is really important in my understanding of eczema. We believe through misconception that products put on the skin stay on the skin. Now, in actual fact, if the skin barrier is intact, they do. But if the piece of skin beside that is eczema and is broken, there are gaps, these products go in the skin. Now, two little words there, on, O-N, in, I-N, you're only changing one letter, but you fundamentally change the outcome of applying those products. They do not stay on the skin with eczema. Misconception. Number 3 is that the creams are inert, because you have something like steroid cream. We know the steroid is active. We're misconceived in hoping that the creams are inert. Again, as we've just done, if the creams are on the skin, nobody's interested. But if they go in the skin, you've got eczema. So I think that's a misconception that the creams are inert. Another one, the immune system is a problem. We put steroids on, we use massive doses of immunomodulators to dampen down this immune system because the immune system is the problem. In a previous video, I discussed how that immune reaction, that inflammation, is actually an indication of the immune system desperately trying to protect the person against the products that are being put on and finding their way in. Therefore, to me, the immune system, the inflammation, is a good sign that there's something else we need to be thinking about. Blaming the immune system for protecting the patient seems a very good way of leaving the patient exposed. That harms the patient. I'm against that. Now one that really does create interest. Steroid creams decrease inflammation. Now immediately any parent who is routinely putting steroid cream onto red skin and seeing that redness disappear has got every reason to say this cannot be a misconception, it's true. Now I would actually agree with them, and I'll take you back again to those two words, steroid and cream. The steroid will get rid of the redness, that's what it does. The cream causes the redness. That's new information. So using steroid creams to decrease the inflammation, I think it's a misconception because it's actually causing the inflammation. It might be hiding the red, but what we're looking for here, if you want to manage eczema, then fine, steroid creams do decrease the inflammation. If you want to end eczema, you have to be thinking differently. Another one that I often hear talked about is the atopic trilogy of atopic eczema, chronic rhinitis, hay fever, and asthma. They all go together. If a child has one, develops a second, nobody's surprised if they develop the third, and once they've got all three, then tough. That child is going to have the atopic trilogy. What I want to present here is that we're getting an increasing number of children who had the trilogy. They had all three. The eczema ended, they're left with the two. I see the immune reaction, the inflammation in atopic eczema, as a fantastic indicator to see what's wrong, so let's stop causing that insult. If you stop causing eczema, the skin can fix itself. So to me, this concept that the atopic trilogy is permanent, in actual fact, is a misconception. Now, let's discuss the fact that bacteria need to be reduced. Now, again, if you had a child that was really scratching, broken the skin, bacteria got in, developed septicemia, that child could die. This is very serious. Those bacteria in the blood can be lethal. So in that case, take the child to hospital, get antibiotics put into the bloodstream, act quickly, really important. Now when the child comes back home, they might be given antibiotic creams. Now again, antibiotic has its role, cream, we've discussed that already. You've got a warning sign there. Now we can raise ourselves some questions. Do we actually want to reduce the bacteria all over the child? Or might we have an opportunity here to say, we can think a little bit deeper here. The bacteria only got in because the child was scratching because they had, and away you go. They had atopic eczema. We now know, in my view, what is causing that atopic eczema, so why don't we stop causing it? If we stop causing it, there are no holes in the skin, the bacteria can't get in. So concentrating on the fact that the bacteria need to be reduced, I see as a misconception. Now one that really does bring tears to certain people's eyes is that I feel wet wrapping is beneficial, is a misconception. Now I readily admit, if you've got a child in hospital, especially a toddler, who are ripping themselves apart, potentially causing lethal septicemias, you might have to wet wrap. That's fine. For today, tomorrow, maybe next week. But think about what's happening in wet wrapping. You've got damaged skin, and that's where the problem is. The child is scratching, so fair enough, you want to defend that. Now then you're going to put your emollients, cream, steroids, whatever you want on here. Then you're going to cover it with bandages to stop this scratching. So scratching fine, but think about what's happening underneath those bandages. We've already discussed that you're putting those products, most of which are based on mineral oil, onto broken skin, therefore into broken skin. And you're covering it with wrapping to make sure that that stays moist, make sure it stays hot, make sure that stuff that you're putting on gets in. Wet wrapping ensures that eczema continues. Therefore, I think wet wrapping is not beneficial. It is a very good emergency procedure, but we've got so many clues before you get to that dreaded wet wrapping stage. Why don't we use them? Another one is that anti-itching drugs help. Now again, if you've got a child so itchy they're scratching themselves to blazes, then fine, use anti-itching drugs. Do they help? If you're ignoring all the clues that we have, yes, they help. If you're wanting to utilize all those clues, you can get rid of the itching. Therefore, you don't need anti-itching drugs. But while you're relying on them, on this side, you're actually saying anti-itching drugs, well, to justify their use, to prolong their use, we'd better keep causing the disease. So that's why I see it as a misconception. Now the final one, you won't be surprised to hear with this series, people say that to manage eczema is the best. Now, out of a choice of one, that's good. If you've got eczema, if it's prolonged, if it's potentially life-threatening, manage it. If that's all you want to do. If you now realise that there's potential to end it, then managing it can't be best, in my view. So this is what I mean about a provocative chapter. Every one of those things that I'm calling a misconception, I believe, is a valid statement now that we've got this other choice of ending eczema. When the world stopped here, eczema meant you had to manage it, bounce back, manage again, bounce back, manage again, fine. All those things are valid. However, when you move on to this side, where you're trying to allow the skin to fix itself, which is what it does in the Eczema program, then things like moisturizers, products on the skin, the creams, the immune system, the steroids, the atopy, and down you go, relying on them suddenly become misconceptions. So I'll end the provocative one there. Thank you. I hope you've stayed with me right throughout this particular video, and look forward to presenting something more to you for Chapter 8. Thank you.